What is a social worker? The aim of this presentation is to explain what does this health professional do, where do they work, who do they work with, how are they governed, what is their role in diabetes care, what is one source of peer-reviewed research on social work, and what is one interesting fact. Social workers provide personal and social support for individuals, families and communities experiencing challenging times. A social worker aims to improve the quality of life and well-being for people that have been marginalized, in crisis, or experiencing physical or emotional difficulty in their lives. On a personal level, social workers provide counseling and support for people in crisis, including youth and people experiencing disadvantages. This health professional can provide information and referrals for further assistance in any circumstance, including mental health problems, family issues, housing support, or access to legal services. Social work provides an exciting and diverse range of career possibilities, from individual counselling to advocacy work to policy development. There are social workers in many organisations, from large government departments to small non-government community organisations. You may find social workers advocating for patients in a hospital, counselling in a private practice, or working in a community centre organising events for youth at risk. These are just some examples. Social workers communicate and work alongside many other health professionals to improve a crisis and lessen the stress and instability. Likewise, social workers can also provide and obtain legal and financial assistance. Their scope of networking support is not only limited to health and medical professions. Social workers work alongside a large group of people within the community. They work with children, families and drug addicts, people with disabilities, and the elderly. They provide specific networks of support for these groups of people. Two examples of other health professionals that you may find social workers working with are legal advisors and counsellors or psychologists. As for legal advisors, although social workers have the ability to give legal advice, they can often network and provide legal advisors for people who are in crisis. This can involve families who may require a lawyer or anyone who seeks legal advice. Social workers are essential to provide this connection. Social workers can advise people to visit counsellors and psychologists for further support. Psychologists and counsellors are beneficial to all groups because they can reduce stress and provide additional support and advice. The Australian Association of Social Workers is the governing body. Like all professions, the discipline of social work is informed largely by its ethical values. Its code of ethics is the core document which informs and guides the ethical practice of social workers. The code expresses the values and responsibilities which are integral to and characterize the social work profession. It is intended to assist all social workers, collectively and individually, to act in ethically accountable ways in the pursuit of the profession's aims. Evidence suggests that poor adjustment to diabetes can be related to rigid beliefs, poor social support, and poor coping strategies. Social workers intervene in a number of ways to address these issues. These include group work with parents, siblings, and adolescents, family therapy, which can be used to facilitate higher levels of family cohesion and communication, which enhances a person's ability to cope with diabetes, joint work with other members of diabetes teams such as a specialist diabetes nurse or psychologist, and they can also liaise with community agents such as housing departments or community welfare officers to improve a client's environmental or financial situation. One source of peer-reviewed research relating to the social work profession is the Journal of Social Work. It publishes articles on the current debates and issues of social work policy, practice, and theory. Social workers are found in every facet of community life, in schools, hospitals, mental health clinics, senior centres, elected offices, private practices, prisons, military, and corporations. Social workers are available in many of our service centres around Australia, or you can speak to one over the phone.
Created using PowToon.